Administration and the Behavioral Health Task Force before that, really instrumental in listening to the community and hearing about the needs. Summer Gathercole is here today, and she's going to be talking about what's coming down the pipeline from the Behavioral Health Administration. She is a deputy commissioner at the new Behavioral Health Administration and will be providing very important information. Thank you, Summer. Feel free to take a seat, or you can take it here.
Good morning, everybody. Good morning, everybody. There we go. Great. Just wanted to make sure that the mic was working. I'm super excited to be here with all of you today. And really, the title of this session should have been Show Me the Money, because that is what we want to talk with you a little bit about today, so that you understand what dollars are coming out of the Behavioral Health Administration, and that can help you plan how you want to spend your settlement dollars. So I'm just going to kind of go through a little bit around what to expect, so that you know what's coming in the coming months, and we can make sure that you have the data to make some smart decisions. So I think you heard from our commissioner, Dr. Medlock, yesterday, so hopefully you are all up to speed on the Behavioral Health Administration. That is the new entity that is responsible for kind of leading the strategy for behavioral health across the state, and we are leading the strategy for all payers. So we are working with Medicaid very closely, we're working with private insurance, and have this long-term vision of making sure that behavioral health services in Colorado are meaningful, trusted, and accessible to everybody who's in Colorado. So that's where we're going to trying to get in the next few years. So let me start off by talking to you about the Continuum Gap Grant Program. As you can see here, this is an investment of $25 million to address the continuum of care in communities. It's also an additional $34 million specifically to address the gaps in the continuum for children and youth. So a couple of things I want to just highlight here is that this work is really going to be helped or complemented by an assessment tool that we are in the process of creating right now. That is something that we will be releasing later on this fall for communities to be able to conduct their own assessment of where are the gaps, where are the needs in their communities, and how can we figure out how to address them. The great news is that when that assessment tool is given out, there will be technical assistance from the BHA to make sure that communities know how to use it, to answer any questions that you have, and again, really want to make sure that you have the data that you need. And one of the things that's important to know about this is that when we are looking at projects, the request for applications will come out by the end of this calendar year. When we're looking at the request for projects, we are really going to be looking at how you use that assessment tool and how that project is really going to help kind of fix that gap or that need in your community. This is a grant program that will be open to community-based organizations, nonprofits, tribes, local government. So really open to all of it, and just want to encourage you to keep an eye. We're going to share with you information on our website at the end of this. That's the best place to go to find out more about some of these grant opportunities.
Somebody might have mentioned,
yeah.
What is the duration for that grant? That's ARPA funds, right?
It is ARPA funds, yes. So it is probably kind of one-time funding. And so all of those details in terms of how long you have to use those funding, all of that will come through in the request for applications. That is still one of the things we're working through, so lots of details to figure out. I will also say, having founded a nonprofit before, having run a nonprofit, having submitted lots and lots of grant applications, we will be really thoughtful about the application process so that you're not jumping through hoops, and yet we still know that we need to get some information to know the outcomes that you are able to achieve. So we will find the right balance there. That's our commitment to you as well. So we also have some investments that are being made specifically for children, youth, and families. And so I want to make sure that you all are aware of this as well. So we will be investing $5 million specifically for residential beds for children and youth. We will be working on these with our current managed service organizations, our MSOs. Our MSOs are the groups that oversee our substance use disorder providers across Colorado. And one of the things that we're going to really try to the greatest extent possible with this investment is to make sure that we're able to have the substance use treatment and the mental health needs in that same facility when we're looking at the residential beds. So that's one of the biggest things that we're looking for as we're really trying to address the bifurcation within the Behavioral Health Administration. We're also going to continue to provide intensive support to children, youth, and families through June of 2025. This is something that we actually are just beginning as a result of funding that we received last year through Senate Bill 137. For those of you who love bill numbers, I'll try to throw them out there when I can remember them. But this is really making sure that kids have the wraparound services that they need. And again, this is just an additional investments that we'll be making through our administrative service organizations, or ASOs, which oversee the crisis services. So this is really a crisis intervention for the children, youth, and families, and making sure that, especially those with acute needs, that we're able to get them access to services very quickly. So of course, I also want to talk about our fentanyl accountability and prevention. For those of you, again, House Bill 1326. And this bill does a number of things. First of all, it does fund our managed service organizations to conduct some regional needs assessments related to fentanyl and other opioids. So this is something that, again, we will be working with the MSOs. We've already started looking at internally, how do we make sure that we're creating an assessment that complements the toolkit that we'll be putting out this fall. Also, again, make sure that you as communities know that have the data that you need to be able to make decisions about how to invest in your community. This also provides our managed service organizations with $10 million in funding to improve and expand withdrawal management and crisis walk-in centers. So really, we want to make sure that, again, people have easier and better access to the services that they need in their communities, and really want to make sure that if we can, every walk-in center, every withdrawal management center in Colorado has the capacity to really deliver or initiate medication for opioid use disorder. So that's our long-term goal there that we're working towards. And then finally, the last thing for this bill is that we as the BHA will be providing technical assistance to the jails to provide medication for opioid use disorder. So again, really making sure that we're not just saying, here's what you need to do, that we're providing some assistance along the way so that counties and communities know how to deliver some of the services that might be new for them. Finally, we also have our diversion efforts. So this is really about how do we keep people from having to interact with the criminal justice system? How do we make, in order to access services? This is one of the big values that came out of the governor's Behavioral Health Task Force, was really making sure people should not have to interact with the criminal justice system in order to access services. So we are fortunate from this past legislation, which was Senate Bill 22196, this legislative session, to receive $50 million. This titled Health Needs for Persons in the Criminal Justice System. These are additional grant opportunities that the request for applications will be coming out later on this fall. This is an opportunity where funding can be used for capital improvements, especially for security and safety as needed. But we're also looking for some creative opportunities to really strengthen our crisis system and again, make sure that people are able to access those services before ever having to interact with the criminal justice system. So more information on those grants will be coming soon. We do expect that the grant opportunities will be posted on our website probably this fall. I'm going to guess sometime in October. So again, $50 million is a good chunk of change and can really make a difference, I think, in our community and in our crisis system. And finally, I'll just talk real quickly about workforce. This is my jam. For those of you who don't know me, I was the Secretary of Labor for Washington, D.C., so I have a long history in workforce development. And of course, we have all this funding coming in. We have all these new initiatives and programs that we have the opportunity to launch, and yet it doesn't do us any good if we don't have the workforce. I'm sure you've been talking about that quite a bit over the last day and a half. We were really fortunate from this legislative session, Senate Bill 22181, to receive $72 million to invest in our behavioral health workforce in Colorado. So there's lots of different ways that we are going to be doing that. Here you see on this screen a couple of examples. So the first one is $29 million to support pay increase for the frontline workforce who are working on substance use disorder. That is actually from Bill 1281, the Continuum Gap bill, the first one that I talked about a couple of slides back. But that's, again, making sure that we're paying our workforce for the value of services that they're delivering and making sure that we're reflecting that. There's also a number of different funding opportunities coming down from 181, including career pipeline grants, opportunities for employers to apply for retention grants, scholarships for peer support so we can grow our number of peers. So just to spend just a little bit more time on 181, or Senate Bill 181, because we are charged with having a plan done by September 1st of this year, so just a few weeks away. We've been furiously working on it to try to really make sure that we're looking at how do we address our behavioral health workforce shortage in a number of creative ways. We have the long-term strategies where we're really trying to make sure that we plant the seed early on so that when we have first graders who are talking about being a nurse or a teacher or a fireman, we have first graders who are saying, I want to be a therapist, I want to be a provider, I want to help people. So that's our long-term vision. But of course, short-term, we need people now, right? So a couple of things that we're looking at through 181 is one, a big kind of national marketing campaign, if you will, to lure experienced professionals here to Colorado so that we can have their experience and expertise here. We're also looking at creating a new, what we're calling behavioral health aid program, which is actually kind of a tiered approach to a behavioral health professional. So if someone is a high school graduate or has their GED, they could become a behavioral health 1. If they go to a 2-year college, they could become a behavioral health 2, and then of course if they're a 4-year college graduate, they could become a behavioral health aid 3. That would be an opportunity to kind of advance careers early on so that people have that initial experience and kind of get a sense of what it's like to be a behavioral health professional. So we're really looking at some different and unique ways that we can help people get their foot in the door, learn what it is like to be and how wonderful it is to be a behavioral health professional, and hopefully what their appetite so that they just want more and more. So the other big piece of Senate Bill 181 is expanding the number of peer professionals that we have across the state. We have heard time and time again the importance of peers, and so we want to make sure that we have like an army of peers across Colorado, and for all different populations and for all different needs, right? So we're really looking at how do we build the cultural competency of our peers, as well as the rest of our workforce. The last panel, one of their last questions was, how do we learn from one another? How do we keep each other engaged? One of the things I'm really excited about that will be launching next year is what we're calling our Learning Academy. And this is an opportunity, this is an online system where providers will be able to get together, learn and build their cultural competencies. So we heard a lot about that need when the governor's behavioral health task force was meeting. We had lots of people with lived expertise come and share with us and say, I tried to find a provider, but I couldn't find one who looked like me or could communicate with me or was from my community. And so we really know that we need to build the cultural competency of our workforce. So that online learning academy is a first step. As we've been thinking about the content, though, what I would say is that we know that there's a lot of people, especially in this room, who already have lots of expertise that we can share through that learning academy. So I think there's opportunities to kind of build off of the expertise of everyone that we work with already, and to also hold webinars and talk across the state what's working, what's not working, what can we learn from one another. So that is kind of it in a nutshell in terms of what's coming down the pipeline and where those funding dollars are coming from and what you can look for. I would definitely encourage you, keep an eye on our webpage for all of those funding opportunities. They will be posted. We also have lots of opportunities for stakeholder engagement that are coming up. So I want to encourage all of you to kind of keep an eye out for those stakeholder engagement opportunities as well. And the last kind of pitch I'll make here, because I know I'm getting the signal that I'm almost out of time, is that we have a big overhaul of our safety net system that we are about to launch. By July of 2024, the Behavioral Health Administration is charged with ensuring that we have behavioral health administrative service organizations, or as we fondly call them, BASOs, in every region across the state. Those BASOs are responsible for ensuring that there's a continuum of care in every region. So those BASOs are going to be responsible for also expanding the number of providers that we work with, especially within our safety net system. The BASOs will be responsible for care coordination, and it's really the consolidation of a system that we have in place right now. So in the last couple of minutes, you've heard me talk about ASOs that oversee our crisis system. You heard me talk about MSOs that oversee our substance use disorder services. We have community mental health centers. In July 2024, the BASOs will consolidate those services and again, really make it easier for people to access services, ensure that we have that continuum of care in every region. The planning for those BASOs actually begins in the next couple of weeks, and we will have extensive stakeholder engagement. So that's why I'm saying, go to our webpage every day, check us out, and keep an eye out, because we really do want to make sure that we're working in partnership with our communities to hear, again, what you need and what's working for you, and what we need to be thoughtful about as we continue to implement most of the initiatives that we've been charged with. All right, thank you all for your time. Really appreciate it. And Jamie, I'll hand it back over to you.
Yeah. Wonderful. Thank you so much for that valuable presentation, Summer, and for all the support of the Behavioral Health Administration. They're going to be a key partner through this work. As you can see, there's a lot of thought going in at the state level about how to address behavioral health. And we're in a pivotal time where we actually have funds at the state through the ARPA, American Rescue Plan Act funds. $400 million came out of the Behavioral Health Task Force. And that's until 2024, I believe. Is that right? And so we have kind of this unique opportunity where we have funds coming through the state that it's addressing Continuum CAP grant, diversion, substance use, residential for adolescents, and workforce, that's all going down to local communities. So we're in the difficult task of trying to figure out how do we use that funds as well as the opioid settlement funds and make sure that they all braid seamlessly. So good. With that note, good luck. And it's time for lunch. So we're a little early on schedule, but we will be coming